So I kind of see people and I see onions, right? So people are onions, and onions means that we got a lot of layers. And this is why I love to see 7-year-olds, right? Because 7-year-olds have one layer,
They do, yeah.
maybe two, right? So you treat that and then boom, they get better. Like they respond really quickly. As we get older, we get more layers. We've lived longer. We got different things going on. And then it becomes like, how do we prioritize concerns? And then we kind of get symptoms or we're walking wounded or something along those lines. So we can kind of go through this onion. And I'm going to tell you basically at the core of the onion, when I see patients, and this is my bias, is that I see, or what I think I'm looking for sure, ruling out is blood glucose dysregulation
Mm.
and digestive issues, right? Because I think that's pretty much the bread and butter of like a starting point on that, right? Where you can talk about adrenal fatigue and we can talk about hormone balance and we can talk about thyroid and we can talk about reproductive. And those are all important, but oftentimes there's something underlying, or we're looking for what's underlying that. Oftentimes it's glucose and or digestion. So and what's important to understand about blood glucose is that your body tightly regulates your blood glucose. Your body does not tightly regulate your blood pressure, does not tightly regulate your cholesterol, but it tightly regulates your glucose. What does that mean? That means that you could have a potential issue with blood glucose and you don't know it. Well, I'm going to tell you that I think that there's even pre-diabetes. So what's pre-diabetes? What that means is you actually have normal blood glucose, but we have a problem. Well, how would you know that you have a problem if your blood glucose is normal, right? Ah, now we're getting into how well you respond to carbohydrates, right? Or what I'm going to say basically is glucose tolerance.
And there's a lot of people that could attest to this that have these sort of symptoms, and maybe we can talk more about when we talk about this further, what those may be, but quote unquote normal testing fasting glucose. How like in the spectrum, of the development to from normal to prediabetes to diabetes, the people that have that dysregulated symptomatic blood sugar but normal, like how much in advance can that be before they actually are diagnosed with prediabetes or diabetes? Can it be
Well, I
years?
mean, I think you go way, but I mean, at 20 years,